Every day here at AirSync, I see underdeveloped jaws, restricted nasal passages, and signs of breathing disordered sleep. These conditions are just a few of the hidden dangers related to tongue ties. But tongue ties are only one piece of the airway health puzzle. They never exist in isolation. The bony structure of the face, soft tissue, nasal passages, tone of the nervous system, and sleep quality all contribute to airway health. That's why we perform a comprehensive airway assessment, including 3D imaging and sleep assessment, before making a tongue tie treatment recommendation. Analyzing the 3D image allows me to see all of the structures surrounding the tongue. The nasal passages, including the septum and room for air to flow, the tongue posture, the space for the tongue, if there are structures obstructing the airway, the adenoids, an elongated soft palate, tonsils, or the tongue, and how much space there is behind the tongue. I'm looking to establish that the oral environment is safe to release the tongue and not cause worsening of symptoms. The sleep assessment, sometimes a home sleep test, sometimes an assessment tool, is looking to establish baseline sleep quality information, including oxygen levels or desaturations. Are there apnea events happening? And it gives me data on the tone of the nervous system. Are you or your child in chronic fight or flight, in which the nervous system and heart are working overtime? Or are all of the body's systems calm and doing what they're supposed to be doing during sleep? If you or your child's sleep data show that you are in significant distress, this may delay the timing of a tongue tie surgery. The sleep assessment also determines if there is a need for immediate referral to either a sleep medicine specialist or the ENT. Generally speaking, patients are referred by their physician or dentist to sleep medicine to assess sleep quality. But unless you have one foot in the grave, otherwise known as a diagnosis of sleep apnea, there are minimal solutions and a wasting of time and money. How about having the whole picture with the answers to why you cannot breathe and why you cannot sleep within a number of days of meeting us? When it comes to babies, I prefer to treat early, and I want to minimize emotional trauma whenever possible. To achieve that goal, we've developed extensive pre-procedure, during procedure, and post-procedure support for our tongue-tied babies and their parents. We may suggest SIVO sedation for older babies as a means to create a safer environment, optimize surgical outcomes, and minimize oral emotional trauma. For adults, if there's a tongue tie diagnosed, we assess the size of the oral cavity before recommending a release procedure. We do this to ensure that there will be enough space for the tongue after the surgery. If adequate space does not exist, a tongue tie release can actually make an adult airway problem worse. Again, it's never just a tongue tie, but if your oral environment and sleep quality are safe, we can provide a customized treatment plan to produce a successful and predictable outcome.